Hello, Namaskar. Today we are starting with the group of anti-psoric constitutional remedies by Dr. E.B. Nash. And the first remedy that we're going to start with is sulfur. So this group actually contains four remedies, which is sulfur, Calcarea Carb, Calcarea phos, and Silica. Okay, so let's start with sulfur. And in sulfur, Dr. Nash explains the remedy also through using, actually a lot of principles of homeopathy. He tells us about law of similia somewhere and somewhere about, suppression of eruptions. So he talks about many concepts when he actually talks about sulfur. So we'll have a talk about all those concepts as well, along with obviously the Materia Medica symptoms. Even if Dr. Nash explains every remedy in brief, he does mention all the important points that one should know about that remedy. And in the same way, even for sulfur, he does cover many important, keynotes of the remedy. So let's start. So these are the topics that we're going to cover. Anti-psoric. Since this remedy is anti-psoric and we're studying about it first, so let's understand what is Psora and what is actually anti-psoric. Why do we need it, etc. He discusses all of it under this heading. Then he goes to the burning sensation which is there in sulfur, the burning pain, which is a very very characteristic symptom of sulfur, its action on circulation, its power of absorption, its power of arousing defective reaction. And here also we will talk about what is defective reaction in the first place, and action on skin. Okay, so let's start with the anti-psoric part, that is the first topic. Before starting, I would like to tell you that this diagram actually, or this drawing actually represents sulfur, but we are going to study about it in the due course, like what has been drawn to illustrate which symptom, and we will talk about that in due course in great details. But right now, let's just focus on the anti-psoric topic, which Dr. Nash starts with. So sulfur is actually called as the king of anti-psorics by Dr. Hahnemann, the founder himself. So it does mean something, right? It is the king of anti-psorics. But to understand what is anti-psorics and to understand the value that of sulfur being the king of all of them, we first need to understand what is Psora. So Dr. Nash explains it in very simple words, very beautifully. Psora is something named or unnamed which must be recognized and complicates so-called acute diseases. So you do not need to name or whatever, you just understand that it is something, okay, which will complicate your disease. So what is the meaning of complicating your disease? Actually, what happens? So when seemingly indicated drugs, means you, what is seemingly indicated drugs means you have a case, and it has come to you with a certain kind of symptoms, certain number of symptoms, and you form the totality of symptoms, and then you come to the conclusion that yeah, this must be pulsatilla or this must be bryonia, whatever. You come down to one remedy. So that is your seemingly indicated remedy because it seems to be indicated in that case. So that seemingly indicated drug does not cure. So although you have seen that this patient that came to you had all the symptoms which were peculiarly present in your remedy, that is pulsatilla, suppose. Okay, and you gave pulsatilla to that patient, but it is not curing. Still it is not curing. Okay, still it is not helping. Now what to do? So Dr. Nash says use sulfur because Psora is the obstacle to be overcome. So here we understand that even if seemingly indicated drug is not curing, which it should because there is law of similia, right? It should cure. But it is not. That itself means that there is Psora, like something which is complicating the case. So you use sulfur because Psora is an obstacle to overcome. Now if you give sulfur, it will help clear up the case, and after sulfur, if you give the seemingly indicated drug, then the patient will get cured of any disease that he or she has. Okay, so now he says that syphilis does the same. Once contracted or inherited, he means the disease, okay, the infection. So if you get infected with syphilis, once contracted or inherited, no matter what ordinary acute disease appears, we are at times obliged to turn aside from its treatment to give a quietus to the old enemy before we can overcome the acute affection. So here he tries to explain that also in syphilis, when anybody has, syphilis which has been inherited, contracted, whatever, if that patient gets any acute disease, even in that case, if you try to give the indicated drug, it might not help, okay, because there is syphilis in the background. Syphilis is also like Psora. So since there is syphilis in background, you'll first have to tackle syphilis. Like here, you give sulfur to tackle Psora. So you'll give some other remedy which is antisyphilitic to tackle syphilis, and then if you give the indicated remedy, the acute condition will be overcome. Okay. Now he says that there are also other anti-psoric remedies. So now we talked about sulfur being the king of anti-psorics, but he is saying that there are also other anti-psoric remedies. Sulfur is not the only remedy which is capable of removing psoric complications, but simply that sulfur will be likely to be oftener indicated because it oftener covers the usual manifestations of psora in its pathogenesis than any other remedy. So what happens is that, sulfur is not the only antipsoric, but most commonly sulfur is only involved. Most commonly sulfur is indicated, meaning that the patient will come to you more commonly with acute basic. For example, if they come to you with any kind of acute problem, okay, and you give them pulsatilla, whatever is the indicated remedy, and they are not having cured of it, then you will most commonly see the symptoms of sulfur in them here and there, okay, and you think, and it most times it will be so that sulfur will be the indicated remedy, meaning that it's the same thing, that you will see the symptoms of sulfur in the patient here or there, and then you will think that sulfur is the antipsoric remedy for this patient. But there are also other antipsoric remedies like Psorinum, Causticum, Graphitis, and these might be needed to be used instead of sulfur if you have the symptoms of these remedies. Right? So if you have a patient with acute condition come to you, and the same thing happens which we have talked about right now, the same concept, that they come to you and you give the indicated remedy but it does not help, then you might need Psorinum. Maybe your patient is extremely chilly and pessimistic, yeah, very chilly, very pessimistic, then you can think of Psorinum as an antipsoric remedy for him or her. Right? Maybe the patient has kind of a soreness, rawness in some parts, yeah. So few symptoms will be there of these remedies, you will find it, and you might, when it might be indicated, and then you give these antipsoric remedies, and after giving those antipsoric remedies, you will see that the picture gets cleared, and now if when you prescribe your indicated remedy, it will help the patient. Now, this was all about the antipsoric part. We saw that Hahnemann says that sulfur is the king of antipsorics. We saw what is Psora actually, and then we have seen the whole concept, and there are also other antipsoric remedies besides sulfur, right? Now, let's go to the the chief characteristic of this remedy actually, the burning of this remedy. So, since burning is a chief characteristic of this remedy, it is found everywhere in this remedy. Yeah, almost everywhere. So burning on vertex, outer and inner head, okay, burning in the urethra, burning in, so that is why I have made this, kind of illustration of fire or burning. So there's burning in urethra because there is burning in urethra. There's also burning in the anus, rectum, and this denotes the same. So there is burning in the rectum, burning and pressure. In the anus, burning and itching and hemorrhoids. Yeah, in the urethra, and this shows the same, and on the vertex, outer and inner head, right? There is burning, water from the nose. The chest may also, there is burning in the chest which rises to the face, burning in the chest which rises to the face. There is the nipples also burn like fire. There's burning in the hands, burning in the feet. So see, there is burning of feet, and he puts them out of the bed to cool. Now, what does this mean? He puts them out of the bed to cool. So what happens is there is certain kind of warmth of bed, okay, so whenever you lie on a bed or mattress, you can feel some kind of warmth that that mattress or bed gives you, okay, so that heat, right? So if a person has already has this kind of burning in their feet, that warmth of bed will aggravate them even more. So what these people want to do is they want to, just put their feet out of the bed, because the warmth of the bed is aggravating their feet, the burning of their feet. So they'll want to put them aside so that it helps them cool off their feet. Okay, and then there is skin. In the skin also we see that there is itching eruptions which burn after scratching. So that this thing shows the same. Okay, so the patient is itching or scratching actually because there is itching in this part, for example, and there's also burning after they scratch that part. Okay, there's burning after they scratch that part. Then we have hot flushes and burning all over. So see, there is hot flushes, there's burning all over, burning between scapulae, burning pain in the tongue, burning vesicles in the mouth. The throat also has burning, and there's also dryness first right and then on the left side of the throat. Right, in the stomach there is burning, the vagina there is burning, so there is burning everywhere, so everywhere. Okay, that shows you how important burning is in this remedy. It really is chief characteristic of this remedy, right? And since it is such a chief characteristic of sulfur, Dr. Nash also says that sulfur is eternally burning. So see, since burning is so much all over the remedy, he says that the remedy is eternally burning. Now the trio of burning that Dr. Nash puts forward is sulfur, arsenic album, and phosphorus. Arsenic album we have already talked about, and we did see burning. Did talk about burning in this remedy, and now we're doing sulfur, which is eternally burning. Phosphorus also has burning. Okay, now Dr. Nash says several other remedies have burning in intense degree. So since this trio of burning is actually very famous all over our college years, everybody knows about what the trio of burning, we tend to ignore, or not ignore actually, we tend to forget about other remedies which do have intense burning. Okay, but we do forget. So now let's try to remember these remedies also. So when you have a patient who comes to you with a lot of burning, you obviously have to think of these three remedies in the very first place, but we should also think of these remedies and not forget them. So aconite also has burning. Agaricus, which is made out of mushroom, also has burning. Apis, which is made out of honeybee, also has burning. Since you know how honeybee bites you and stings you, sorry, and you have that kind of burning sensation after the sting of the bee. So obviously, since it is there in the bee, it will be there in the remedy also. So there is belladonna also has burning. Capsicum we have done just now, it also has burning. Carbo animalis, phosphoric acid, and cantharis. Cantharis and apis both have burning. Okay, cantharis also has a lot of burning. So all these remedies. Now choose the remedy showing complete picture of similarity. So although so many remedies of burning, right? So many remedies have this symptom of burning. The final prescription always is based on the complete picture of similarity. So you cannot ever prescribe only because there is burning. So patient comes to you and he tells you that there is burning here, there somewhere. Okay, you cannot go give him sulfur because now you know that sulfur has this eternal burning kind of thing. No, it homeopathy doesn't work like that. We have to find the totality of symptoms. We have to take all the symptoms into consideration and then see what picture actually matches to picture of which remedy matches to the patient, and then prescribe that remedy and it will help. So most probably it has to be a remedy among these because these all are burning, have burning symptoms. Okay, to an intense degree. Now Dr. Nash makes an interesting statement. He says that arsenic has burning. See, both have burning, but arsenic leads in all acute diseases and sulfur leads in all chronic affections. Sorry for the mistake, it leads in chronic affections. Okay, arsenic leads in all acute diseases and sulfur in chronic. So this was about the burning of this remedy. Let's go to the action of sulfur on circulation. Find out what does sulfur do. Okay, acting over circulation. So sulfur actually cures local congestion or chronic tendency to cause congestion. So both. If there is local congestion in some patient, if some patient has a chronic tendency to cause congestion, it will cure both. Now what is congestion? Congestion actually means, whenever you have a kind of maybe inflammation or maybe any pathology because of which all your blood is not all in the sense all, but most of your blood is trying to go to that part of your body. So now see, whenever you have inflammation, suppose now I get a wound. Okay, maybe I just get a wound over here. What will happen is inflammation will take place, and since inflammation will take place, there's wound and my body needs defense over here, right? what it will do is it will try to enhance the circulation of this place. Okay, it will try to move more amount of blood over here, so that the WBCs reach over here, all that is needed reach over here, and the inflammation and finally the recovery of that wound takes place very nicely. So the blood will rush over here, right, for that cause. So that the rushing of that blood is itself called as congestion. So local congestion might take place, chronic tendency to cause congestion. Some patients can have chronic tendency to cause congestion. So that both it will cure, both sulfur will cure. So how does it manifest? So these acute or chronic congestion, whatever, they manifest themselves in swellings, in boils, phelons, suppressed hemorrhoids may be there. And these you had hemorrhoids, okay, you suppress them, meaning maybe you did do a surgery of hemorrhoids or something like that, and it finally now leads to congestion to the head. So earlier there was hemorrhoids and all the blood was going into the hemorrhoids, okay, but now it is now going to the head or abdominal or portal congestion and inflammation. It is now causing this or this. Now the chest becomes congested. If the chest becomes congested, what happens is that there is difficulty of breathing. So the patient feels oppressed and he wants doors and windows open. Okay, so this remedy does have this symptom that they want all the windows and doors open. Even if they're sitting in the room, they will open the window. So there is this, but here he is talking about it because this congestion of the chest, and therefore this difficulty of breathing, and he wants it open. Now this rush of blood seems to fill the whole chest. The heart feels as if too full, palpitates, and labors as if trying to rid itself of a burden. Okay, so that much is the rush of blood. Now you see that there is the orifices of the body also are red as if pressed full of blood. So there is this circulation, right? Circulation mein aisa hai ki more of the blood is going to different parts, like orifices of the body, also to the eyelids, to the ears, to the anus. Okay, so these things. So I have made it in the diagram. Also the lips are red as if vermilion, and he also talks about it that the lips are very dilated, like they're big. So that is what we've made. And then there is all the orifices actually, like the urethra, the anus, all of them are red as if pressed full of blood. Lips are red as vermilion. Ears, so ears also we've tried to kind of make a little bit of red tinge, add a little bit of red tinge to it. So that's also there. Okay, so you see this in this remedy. First of all, this congestion, and then there is this, all these orifices of the body are red. Now if you have these symptoms of sulfur, if these indications of sulfur manifest themselves, they are more, even they're true, like you're confirmed about the remedy being sulfur, if the ailments from of all of these symptoms is suppression or retrocession of some eruption or skin trouble. So if you had an eruption or any skin trouble and you suppressed it with the help of any ointment, or you just applied it on, like there the problem always lies inside of you, and because the problem lies inside of you, meaning your vital force is deranged, that is why your body is trying to actually tell you that the vital force is deranged through the symptoms that it produces. And those symptoms should not be suppressed by any kind of ointment, etc. It should actually, what you should actually do is you should understand this language of the body to tell you that there is some problem inside, and that because of that problem the body is actually creating all these eruptions or any disease that you have. So your job is to actually cure the, or revitalize the vital force that is inside, or just help the vital force that is inside. And if you do that, then the eruptions will go off by themselves. This is what happens in homeopathy actually. When you give an homeopathic remedy, the correct indicated remedy, to a patient who has any skin trouble, you are actually not giving him something that acts exactly on that eruption, because it is not local, right? It is not in a crude form that you're giving. So it will go and act on that energy which is deranged inside of you, and that energy will itself guide your body to get rid of that eruption, because that eruption was anyway a flag to tell you what's going on inside, right? So if you just suppress it by putting on something, ointment or something, and not giving any medicine to help the vital force inside, then it is called as suppression. So that happens. Or retrocession, meaning that the eruption came, okay, but it was not completely developed or something, and then it went on itself only. It did not completely develop also. So the eruption came, but in the earlier stages, when it just, when it was just coming, it again went off after a few days. It did not actually develop into a complete, into its later stages, or into the complete picture of whatever that eruption has to do, like whatever stages it has to go through. It did not happen. So that if that happens, and after that you get any kind of symptoms of sulfur that we are now talking about, or we will talk about, whatever symptoms that sulfur anyway has, if there is ailments from like this behind of it, okay, then you have to be sure of sulfur. You can be sure of sulfur. Okay, now Dr. Nash says if inward affections work outward towards the surface, there is not usually cause for alarm. Now, first of all, what does this much mean? Now, he says that if you have any inward affection, meaning that suppose you have a problem in your liver, okay, maybe you have fatty liver, something like that, maybe, okay, or maybe you have a peptic ulcer in your stomach, okay, or in your duodenum, whatever, that is something that is inside, okay. So there is in this, that is inward affection. Now if it works outward, meaning that you first of all had a peptic ulcer and you were given a correct homeopathic remedy, after which you developed an eruption. Eruption is outward, skin is something outside, and skin is not that important, or as it is important, but it will not cause you that death, right? It will not cause you death in a very critical. It will not lead to a very critical situation. There are rare dermatological diseases which will be actually very very critical. So inward affection was your liver getting affected, your stomach, your heart, your brain. These are vital organs. So if they get affected, you will really be in trouble, right? So inward affections meaning action on vital organs. So whatever vital organs you have, if there is some kind of disease in your vital organs, and after giving the correct homeopathic remedy, the disease comes outwards, that is, it affects maybe your skin, okay, then there is no cause for alarm, because that is how your body, actually the energy inside of you is doing it. So vital force is the energy inside of you which actually does this. It tries to affect the less important organ and not the more important organ, because the only function of causing a disease or creating a disease that your vital energy or vital force has is to tell you that there is some problem inside, so that you correct it. So if it does happen in this way, there is no cause for alarm, because it is actually helping you. It's not now, say the earlier the disease was in the vital organs, but now it's on the less important organs, so that is a good news, right? Yeah, but and this will also go off, okay. It is not like that it is not like you first had a heart disease or a heart condition, or your stomach or liver, whatever, but now it is on the skin and it will stay on the skin forever. It's not like that. The skin eruptions will also go away and you will be completely healthy. But this is the way that it happens, okay. This is the process through which it happens. Now this much is okay, but if they go the other way, look out for breakers. There is a shipwreck ahead. So he says that if they go the other way, meaning if they go in the opposite direction, your patient earlier had skin eruptions and you gave a remedy, and now the skin eruptions went away because of the remedy. The patient is happy, you are happy, but the patient returns and tells you that I have some kind of a issue inside, and the disease is now affected some more important organ. Maybe the patient has got IBS, maybe the patient has got asthma. Okay, so now it is again gone in. So that is, now look out for breakers, that is, there is shipwrecker. So that is like horrible. You have, something bad is going to happen. That is what he is saying. No one need tell me that there is no relation of skin to internal troubles. So now everybody will say कि ऐसा तो कुछ होता नहीं है, how can a skin eruption be related with the asthma that you have or with the peptic ulcer that you have. But so that is what he is saying. Don't tell me that there is no relation of that kind. I have seen too much of it and have cured many cases of that character, where a restoration of the skin disease relieved the internal which had followed its retrocession or suppression. So this is what Dr. Nash says. He is a master himself. He has worked up so many cases, helped so many patients, cured so many patients, and he has a great experience. When a master like him says this, we should believe it. He says that he has seen so many cases of this kind. He has seen the restoration of skin disease, okay, which relieved the internal, which had followed its retrocession or suppression. So this some patient came to you with a certain kind of symptoms, and then you see that after giving the right indicated remedy, that that disease went away and eruptions came up, and after that eruptions also went away because the eruptions were in the history suppressed. And there is a case like this when in the due course we will also discuss about that case. It is very interesting, and it it will tell you more about this same concept, and will actually clear up the concept for you. Next, talking about the power of absorption of this remedy, Dr. Nash actually means that this remedy can be used in effusion, in which there is a lot of secretion of fluids. Even later when so it can be used after the stage of effusion, or even later when the stage is passed and the results of the inflammatory process are to be gotten rid of. So in both the stages it can be used, maybe just after the stage of effusion, like now the effusion has taken place and there is a lot of fluid, maybe in your pleura, maybe in your serous sacs, there is a lot of fluid, and now you have to do something for the patient. You can give sulfur if obviously the symptoms agree. Or even after the stage has passed and only some inflammatory processes are still lingering on to that part in the pleura, in the serous sacs, maybe whatever, meningeal membrane, peritoneum, at that stage also you can give it. So these kind of things are these kind of regions are affected actually, because these are mostly the places where effusion happens. Pleural effusion you might have heard of. So that kind of things. Now even in rheumatism, what happens is there is exudations in the joint, right? The synovial fluid gets accumulated, and even that synovial fluid can be absorbed with the help of sulfur. Okay, that is what Dr. Nash is trying to tell us. Now, Dr. Nash says that bryonia is one of the remedies first to be thought of in these cases. Yeah, bryonia is actually a very important remedy for effusion kind of a state. So there can be serous effusion or pleural effusion, whatever, synovial fluid also. So bryonia is actually very helpful in these kind of cases. Another remedy he says that is helpful is Calimure also. Calimure is also a very important remedy. But now when will you give sulfur? So it is obviously guided by symptoms only. So when you have a case which is complicated by Psora, meaning that there were maybe there is some block. Maybe bryonia is the remedy, but it is not helping. There is some block to cure, and there might have been an eruption, an history of eruptions, or there might be burning which stands out prominently. In such case, sulfur will obviously help the case. Okay, sulfur will be needed before the case is finished. So you are giving bryonia, but it is not helping the patient, and you also find that there is burning in this patient. That will prominent burning actually, that will point towards sulfur. If you give sulfur now at this stage, and after sulfur you give bryonia, you'll see that the patient gets cured. But earlier when you were giving only bryonia, the patient was not getting it was not helping much as much as you wanted to, or actually you have seen it to help. Okay, that happens. And anyway, bryonia and sulfur complement each other. That is what Dr. Nash says. But of course the symptoms must decide, and may decide in favor of or neither of them. Okay, so whatever it is, symptoms are the guide, but bryonia and sulfur are both of them are complementary to each other. Next, we go on to the power of arousing defective reaction. Okay, so first we need to understand what is defective reaction, which is getting aroused by sulfur. Okay, so first of all, what is it? Okay, now you take a case. Okay, you have taken a case, and you also chose a remedy homeopathically, meaning that you took a totality of symptoms, and you watched out for the simillimum. You found out the seemingly indicated remedy, and you choose it, and the remedy is prescribed. Now, this remedy helped the patient in some measure, but did not cure. Instead, the case may be relapsed. What is the meaning of relapsed? Meaning that now it got cured. Like for example, you gave the remedy, and the patient now just felt very good, completely better. But after 2 months, he again comes to you for the same complaint. That is the meaning of relapsed. So the same complaint comes again, or maybe lingered. meaning that it, like the patient is saying that yeah, maybe I'm better, yeah, I'm little bit better but not completely. So that kind of a thing, that kind of a phase goes on and on and on. So the case is lingering, or it is slowly progressing, meaning it is not even getting cured like it happened in the first case. It is just keeping on progressing very very slowly. So now, why is this happening? Because you gave the correct remedy, right? You chose a remedy, that too homeopathically, following all the principles of homeopathy, and you did everything correctly. But even then, the cases may be relapsing, maybe lingering, maybe slowly progressing. Why? So now Hahnemann over here calls it depression of vital force. Okay, so the vital force is actually depressed. This is the defective reaction to the well chosen remedy. So, whatever well chosen remedy you've given, to that remedy, the vital force is not reacting correctly as it should. So, there is defective reaction. Now, this defective reaction may be on account of Psora or may not be on account of Psora. So right now when I am telling you all of this, which Dr. Nash has written, you will say that just now we talked about Psora. So it is the same thing, right? Psora is also the same thing. So let's see, okay? It may be on account of Psora or not. Now give a dose of sulfur and let it act a few hours if acute case and number of days if it's a chronic case. So if you have acute case and this scenario takes place in the acute place, give sulfur and wait for a few hours, and if it's a chronic case, give sulfur and wait for a few number of days. Now then you may return to your former remedy. After this, again give the remedy that you have well chosen, the one you have homeopathically chosen, and now get the results which you could not before sulfur was given. And now you will actually get the results which were before sulfur was given, which were not there. So sulfur clears up the case and prevents its becoming chronic or lingering unsatisfactory convalescence. Okay, that is what happens with sulfur. So maybe it is Psora that is causing the problem. Maybe it is the defective reaction of the vital force that is causing the problem. But the picture remains the same. What you have to do is you have to give a dose of sulfur if there are indications, and then you have to follow it with the well chosen remedy, and cure will follow. Okay, now let's go to the last point of this remedy, which is the action of this remedy on skin. So here again Dr. Nash says that when this remedy acting on skin, what it does is actually itching and burning with or without eruptions. So even if there are eruptions, even if they're not, there will be burning, there will be itching. Sulfur has great itch producing power, great affinity for the skin. Sulfur is bent on pushing everything internal out on the surface. That is what Dr. Nash says. So whatever kind of symptoms that you have inside of you, like you might have asthma or whatever major organs are affected, if you give sulfur, if the indications are there for sulfur, then that disease will go away, and the suppressed eruptions which you had suppressed a few years ago, or whatever, a few months ago, that will come back on the surface, and eventually that will also go, and you will be completely cured with no relapses, no lingering, no slow progression, nothing, no relapse actually. Now, there is a case illustrating this. I told you that we are going to talk about a case. So there is a case illustrating this. There was a lady, okay, who came to Dr. Nash. She was sick for 14 years. So that she had this disease for 14 years. Some stomach related issue, diarrhea and all that she had. So she had some stomach related issue. Her trouble seemed to center in her stomach. So she could not eat anything, okay, anything except little bread and milk. And that little bread was so little that she could hardly sustain life. She was almost a walking skeleton. Now, what happened is, on case taking, Dr. Nash found out. So, Dr. Nash actually did not find out in the first place or in the first, consultation. He failed many times. So, he gave the remedy which was indicated, but the patient was not getting better. Then he thought that maybe I gave the wrong remedy. So, he again gave some other remedy, or some other symptom came up and gave some other remedy, which was seemingly indicated, but that did not help. So, in this way, he had failed many times. After which he found out that 15 years ago, okay, 15 years ago, so she has been sick for 14 years. And 15 years ago, this lady had eczema of nape and occiput. Okay, eczema of what? Of nape and occiput, and there was an ointment which she applied which suppressed this. Because as I told you, the problem is not on the skin when the eruptions come up on the skin, but the problem is inside. Problem is in your vital energy, and that vital energy is trying to communicate you through producing these eruptions, telling you that there is some issue inside. Please correct it. This is the simplest way I can put it. Okay, so now what happens is that when you give the correct homeopathic remedy, the vital energy gets healthy, and it gets like the derangement goes away and it is now normal, and that is why the eruptions will go on their own. So, but if you apply ointment and you do not at all look at the internal problem that has happened, you are suppressing the eczema. So 15 years ago, this lady had suppressed the eczema, and 14 years early, means 1 year after this suppression, she started with this stomach issue, and because of which now for complete, for a whole 14 years, she has not been able to eat anything, only little bread and milk. What happened next? So next, the treatment that Dr. Nash gave was obviously sulfur, and why he did that, he has already explained to us through the whole content of this remedy, why he came to sulfur. Okay, so what happened after giving sulfur? Follow-up within 3 weeks was that the eruptions came back and her stomach trouble completely relieved. So see, she came to you for stomach. So she came to Dr. Nash for the stomach related trouble, right? But when Dr. Nash understood that there was suppression of an eruption, he gave sulfur because he understood that the problem lies there. And after giving sulfur, the stomach issue completely got better, and the eruptions which were suppressed so long back, that is 15 years ago, came up again. Now, obviously, eventually those eruptions must have also gone away. But at least, even if there are eruptions on your body, you will not starve to death because of it, right? She was starving so much that she had become a walking skeleton because a more important organ of her body was involved. That is her stomach, her intestines were involved. Right now, even if there are some eruptions on the skin, obviously there will be a lot of trouble with eruptions, but she is not going to be a walking skeleton or something who is just surviving, right? And these eruptions do not stay forever, they also go away with the correct homeopathic remedy, right? So that's not an issue, the patient is completely cured. Now, one thing must be recognized, that symptoms weigh whether we can give the pathological interpretation of them or not. Never forget. So that is what Dr. Nash says, and it is of great importance. He says that you should always understand, you should recognize this, that the symptoms weigh more. Okay, now see what happened in this case. What happened in this case is actually what happened in many cases that Dr. Nash has seen, and many cases that homeopaths all over the world see. So now over here, if you try to think what is the pathological interpretation, how can a stomach related issue because of suppressed eruptions, all of that is not that important if symptoms are telling you about it. So this is not what he has done only once, or many homeopaths have done only once or twice. This is what is we have seen with evidences for so many years now. So symptoms do weigh more, right? Symptoms are something that you should pay your attention to, and not only pathological interpretation. Even if today we are not able to understand how this happens pathologically, okay, it has to have some relation which we do not understand today. Even then we can rely on what the symptoms are telling us, because this is what happens, and this is what just convinces you that there is something like this, because this is what you yourself see in your clinic. And at that time, we should not do the mistake of ignoring these symptoms and ignoring the truth that has been shown through these cases, because we cannot explain it pathologically. Today we cannot explain it, but maybe tomorrow, when the research goes ahead, when science goes even more ahead, we will be able to give a pathological explanation for this also. So this was about sulfur, but there are a few more symptoms that Dr. Nash gives at the end, which we are going to discuss. So here Dr. Nash is actually talking about sulfur, okay. He says that this remedy is particularly efficacious with lean, stoop-shouldered people who walk or sit stooped. Standing is the most uncomfortable. So see this remedy, see this, drawing. This patient is stoop shoulder. He's lean, stoop shoulder, and these also people walk lean stooped, okay, and standing is the most uncomfortable position. They do not want to stand, they do not like to stand. These are dirty, filthy people prone to skin affections. So yeah, this prone to skin affections you must have understood until now. The last point we talked about was the action on skin. So these are dirty, filthy people prone to skin affections. Children cannot bear to be washed or bathed. So see, so there's this bucket and they do not want to be washed or bathed. Okay, they do not want that to happen. And then there is this voluptuous itching, scratching relieves, but after that there is burning. Complaints continually relapsing. Congestion to single parts. This also we've seen. There's pain in heart extending to the back. Then scrofulous, meaning this chronic, psoric chronic diseases that result from suppressed eruptions, that also we've seen. Discharges from every outlet are acrid, excoriating and reddening. So all the orifices of the body are reddened, and there are the discharges also which take place, like from the nose we've seen there's burning kind of discharges. So whatever discharges are there, those are acrid, excoriating and reddening. There's offensive odor of body despite frequent bathing, okay. Even if they bathe frequently, the odor of the body will be very offensive. And they also have this aversion to being washed or bathed. Now, there are hot flushes in this remedy with spells of faintness or debility, passing off with little moisture, faintness or debility. Hot flushes will be there. There are circulation related issues, so hot flushes are also there. Weak, faint spells frequently during the day. There's burning in the feet. See, this denotes the burning in the feet. Wants to find a cool place for them, puts them out of bed to cool them off. We've seen this. He feels suffocated, wants doors and windows open, particularly at night. This also we've seen. They have diarrhea after midnight, painless diarrhea, which drives them out of bed early in the morning. This is a very, very important symptom of sulfur. Early in the morning, they will have to run to the, a loo, because they have this kind of loose stools and they want to go. So as if the bowels were too weak to retain their contents. And this is also 11 a.m. hunger is also very important. They have this weak, empty go on or faint feeling in the stomach at 11 a.m. That means they feel very hungry at 11 a.m. They have a white tongue with very red tip and borders. Bright redness of lips. See, bright redness of lips as if blood would burst through. So the lips will look like that, okay? And it is also seen in tuberculinum, this kind of symptom. Heat on the crown of the head, cold feet. So that is why the feet are made with blue color. The feet are cold, but there is burning also, right? There is burning in feet, but the feet are cold. And heat on crown of head, cold feet, frequent flushing. Every true homeopath knows the value of these symptoms, right? And many more symptoms of this remedy. No one else appreciates them. Again, none but those who use the potentized sulfur can ever know what it is capable of curing, right? That is what Dr. Nash speaks at the end of the remedy, and he beautifully talks about this remedy and ends this remedy. After which he talks about Calcarea austriarum, which means Calcarea Carb, which comes in the second place of his Psoric and Constitutional remedies list. Okay, so this was all about sulfur, this man. And I hope when you see this this drawing, you kind of recollect many symptoms of sulfur, and you recollect when we talk about sulfur, what did we talk about sulfur other than the symptoms, the concept of anti-psoric remedies. We also talked about the defective reaction and the suppression of eruptions and the disease now affecting the more important organs of the body, etc. Okay, so that was all about sulfur. Let's meet in the next video when we talk about Calcarea Carb from Dr. Nash's Materia Medica. So bye bye until then.